Good evening and a very warm welcome to the eminent doctors joining us today, as well as the audience that's viewing this important session that we are conducting today. Essentially, we are here to discuss about obesity and particularly on infertility, diabetes, the two comorbidities that are associated with obesity, and how bariatric surgery can be a probable solution to overcome these comorbidities, overcome obesity. So, joining me today, I have three top doctors from the city of Gurgaon, India. To begin with the introductions, first I have Dr. Vikas Singhal. He is a senior consultant for minimal access, gastrointestinal, and bariatric surgery affiliated with Medanta, the Medicity Hospital in Gurgaon, India. Joining him today is Dr. Parjeet Kaur. She is a senior consultant endocrinologist, also practicing at the Medanta, the Medicity Hospital, Gurgaon, India, and Dr. Shradha Chaudhari. She is a senior consultant, Department of Gynecology, also practicing at Medanta, the Medicity Hospital, Gurgaon, India. The topic for today's panel discussion is on managing infertility and diabetes through bariatric surgery. And I would like to start my discussion with Dr. Vikas Singhal. And I first want to understand, Dr. Vikas, your thoughts on comorbidities and obesity. So we all know that obesity is on the rise, and there are a lot of health complications that are being associated. What advice do you have on this, and what is your take on comorbidities in obesity?
Thank you, Dr. Dhara. As you very rightly pointed out, we are currently going through a pandemic of obesity and the problems that come with obesity. So we know, initially the thought process was that, okay, that somebody is just overweight or obese, how does it matter? But what we have realized over time and last couple of decades, as obesity has grown manyfold, is that obesity comes with a host of problems. The comorbidities are really from head to toe. If I start enumerating, it will be a lot to go through, but just to briefly say, like starting with headaches, migraine, going through eye problems, going through chest problems, sleep apnea, respiratory problems, cardiac problems, early onset heart disease, because obesity comes with metabolic syndrome, the syndrome comprising obesity, insulin resistance in the form of diabetes, high cholesterol, high blood pressure, which is still not very well understood, but we know that metabolic syndrome runs together and predisposes to early onset heart disease, stroke, a host of other problems. Going down the body, fatty liver disease, multiple cancers throughout the body, infertility because of the association of obesity with PCOS. And more than the comorbidities or the associated medical problems, there is a mental health issue. Patients have low self-esteem, they have depression, they generally have a poor quality of life. So, number of cancers have now been proven to be associated directly with obesity. So it's a host of comorbidities, host of problems, and generally overall put together a poor quality of life that the patient faces.
Yeah. Thanks, doctor. I think, considering obesity has so many health issues associated with it, it's quite overwhelming for the patient as well. आप क्या कहना चाहेंगे? Somebody is obese and उनको diabetes भी है, तो ऐसा क्यों है? अगर ये पेशेंट को आपको समझाना है कि ओबेसिटी में डायबिटीज का इतना एसोसिएशन क्यों हो रहा है, तो इसके लिए आप उनको क्या एडवाइस करना चाहेंगे?
ये देखा गया है कि ओबेसिटी के साथ में डायबिटीज बहुत कॉमनली रन करता है. इसको अब हम पैंडेमिक ऑफ डायबिसिटी भी बोलते हैं, क्योंकि दे आर सो कॉमनली एसोसिएटेड टुगेदर. ओबेसिटी के साथ में इंसुलिन रेजिस्टेंस देखी गई है कि जो बॉडी का इंसुलिन है वो कम काम करता है, बॉडी का इंसुलिन प्रोडक्शन कम होता है, और बहुत सारे फैक्टर्स हैं. एक जो कि एग्जैक्टली पिन पॉइंट करना मुश्किल है, बट जनरली व्हाट वी से इज द मेटाबॉलिक सिंड्रोम जो पेशेंट्स में देखा गया है. And it is seen that, of course, Dr. Parjeet, we have an expert who will, go into more detail on this. But we have seen that in type 2 diabetes, it is associated almost in 85% patients with being overweight or obese. So that's how, how linked it is. And we know that if patients have obesity, अगर किसी को obesity की problem है, तो उनका diabetic होने का chance multiple times है. Some studies say 8 times, 10 times. It is difficult to give a number, but जैसे जैसे weight बढ़ता जाता है, वैसे वैसे वो risk diabetic होने का बढ़ता चला जाता है. And we need to address the patient as a whole, and कि हमें उनको सारे factors इकट्ठे treat करने.
और आपके कोमोर्बिडिटीज में द अदर वन दैट यू मेंशन्ड वाज इनफर्टिलिटी पर्टिकुलरली. सो व्हाट इज एग्जैक्टली इनफर्टिलिटी एंड व्हाई ओबीज पेशेंट्स में ये क्यों देखा जा रहा है? क्या वजह है कि ओबीज women आर कंप्लेनिंग ऑफ बीइंग इनफर्टाइल या ओबीज men आर बीइंग कंप्लेनिंग ऑफ बीइंग इनफर्टाइल?
So again, infertility is seen to be manifold. Both male infertility and female infertility have been linked to obesity. There are several reasons for it. Um, um, in in men, it is seen that with obesity there is a higher degree of impotence, the impaired male sex hormones, the testosterones. There is in women, it is seen that obesity is very frequently associated with PCO, or the polycystic ovarian disease or syndrome. And again, the associations are not very clear, but what is sure is that even, let's say BMI more than 30 with obesity, more than 30% women are supposedly suffering from infertility. Which is or PCOS, sorry, not infertility, PCOS, which is a very high number. So PCOS is one of the most common causes of infertility in women, due to a complex metabolic association with obesity. So it is very highly linked with obesity, which again we have an expert, Dr. Shradha Chaudhari, who will be elaborating further on that.
Thank you, Dr. Vikas. So, abhi Dr. Vikas just gave us a bird's eye view of two of the conditions that we want to discuss more in details. So, my next question is to Dr. Parjeet Kaur. Dr. Vikas mentioned that risk of diabetes increases as the patient becomes more and more obese, or if he has a higher BMI. So, how is it that severity of diabetes and severity of obesity is intertwined together, and what are the possible implications for a person who is probably, say, morbidly obese, severe obese? How does it affect his blood glucose levels, or his diabetic functions or endocrine functions, etc.?
Right. Thanks, Dr. Dhara. So, let me first clarify the definition of obesity in Indians. It's completely different from what we take the BMI cutoffs in Western countries. So we Indians are qualified as being called obese or overweight at much lower BMI. So the BMI cutoff for what to call obesity in India is 25, and to call overweight is 23. So why this cutoff is lower in Indians is because we Indians have a completely different metabolic phenotype, because even with slight accumulation of body fat percentage, there is huge increased risk of metabolic syndrome and type 2 diabetes. So what happens in obesity or increased fat percentage in a person is that once the person loses this capacity of storing all the fat in the under the skin or subcutaneous tissue, this fat starts getting spilled over in different organs, including your heart, liver, pancreas. Especially in the liver and pancreas, when this happens, a condition called insulin resistance happens. And this insulin resistance, because insulin is the main hormone which controls the blood sugar, so when this insulin hormone is not able to act, then it leads on to develop diabetes. So definitely there's a clear cut link between the obesity, the increased body percentage fat, and diabetes. In fact, now the term of obesity is being replaced with ABCD, adiposity based chronic disease. It is the initial point where all the comorbidities are arising. And as we clearly know, that as the severity increases, as the BMI increases, the severity of developing not only diabetes, uh, the cardiovascular diseases, the including your ischemic heart diseases, stroke, hypertension, cholesterol levels, all are increasing rapidly. So this kind of association, this kind of model of understanding that obesity is a disease, it's just not a high body fat, it's very, very important, so that we can act at a very early level called primary prevention to prevent development of various diseases, and if required, when the comorbidities have already developed, like diabetes has come up, cardiovascular disease have come up, we need to look at the other interventions for weight loss, because it has been clearly shown that even the 5% weight loss can make a huge difference. And these days we are hearing all about diabetes remission, reversal, and this is happening with a good amount of weight loss. So we need to be very much aware of all the strategies where we can take care of our body weight.
Thank you, doctor. Uh, you mentioned in your discussion that diabetes in obese patients, it has several complications. You mentioned hypercholesterolemia or stroke. So I wanted to ask you that, is it that in a obese patient who is also diabetic has more complications or has a risk for more complications than somebody who is non-obese and diabetic? So is it true, or is the risk same for everyone?
No, definitely the risk is different, because I just mentioned obesity itself is a disease. So whether or not you have diabetes or not, along with the obesity itself is going to give rise to a lot of complications, including all those cardiometabolic complications. When together combined with diabetes, it increases the risk of complication multiple times. This is especially true for the cardiovascular diseases, the heart attacks, the high cholesterol, hypertension, because these are the main complications which leads to ultimate mortality of in patients with type 2 diabetes and obesity. So yes, if the patient with type 2 diabetes is obese, is going to face much more complications, not only in terms of cardiovascular but other complications including NAFLD and other comorbidities, as Dr. Vikas had already highlighted, including obstructive sleep apnea, psychological issues, which creates a lot of problem in managing these patients. Whereas the patient of type 2 diabetes who's not obese, a lean patient who does not have much of body fat percentage, will do much better with minimal amount of medications. So that definitely is a huge difference between the two groups.
Okay. And आपने डायबिटीज रिवर्सल के बारे में भी एक मेंशन किया कि अगर ओबीस पेशेंट अपना वजन घटा ले तो उसका डायबिटीज प्रिवेंट कर सकते हैं या रिवर्स कर सकते हैं। तो इसके बारे में आप थोड़ी सी और जानकारी देंगे कि हाउ डज इट एक्चुअली व्हाट an obese patient should watch out for and should target to lose weight so that if he is pre-diabetic, अगर वो बॉर्डर लाइन डायबिटीज में है तो क्या वो उसको completely प्रिवेंट कर सकते हैं, या अगर डायबिटीज है तो क्या वो completely क्योर कर सकते हैं वजन घटाकर।
या सो डॉक्टर धारा, बहुत ही सही सवाल है कि ये वजन घटाने का जो हम रोल है इन प्रिवेंशन ऑफ डायबिटीज़ इज़ वेरी ह्यूज, बिकॉज अगर किसी पर्सन को डायबिटीज़ नहीं है बट ही इज़ एट रिस्क ऑफ डायबिटीज़ बिकॉज ऑफ द ओबेसिटी एंड द फैमिली हिस्ट्री, there is a large scope that if he takes care of his weight, then the development of pre-diabetes itself can be prevented. और एक बार अगर प्री डायबिटीज़ भी हो जाती है, अगर उसमें भी वजन घटाया जाए तो हम उसको कम्प्लीटली नॉर्मल लेके आ सकते हैं एंड डायबिटीज़ को होने से बचा सकते हैं। और अगर डायबिटीज़ हो भी गई है, इवन इन दैट केस ऑल्सो वेट लॉस हैज़ अ ह्यूज बेनिफिट, बिकॉज उससे डायबिटीज़ का रेमिशन या हम रिवर्सल जिसे कहते हैं अचीव कर सकते हैं। So this effect actually we start seeing even with just 5% of the weight loss. For example, a person with 70 kg come to you, 5% will be just 3.5 to 4 kg. So even that much weight loss can make a huge difference in cutting down of the medications, and further 10% to 15% weight loss can lead to easily diabetes remission or reversal. So role of weight loss is there, right, starting from the primordial prevention to primary prevention to secondary prevention, tertiary prevention. It is the center part of the management of diabetes.
Thank you, Dr. Parjeet. It's quite interesting and insightful to know that, even as less as 5 kgs can have such a huge impact for a patient who is probably, struggling with diabetes. So, thanks for driving that message. Another part that Dr. Vikas highlighted when he introduced us to comorbidities with obesity was about infertility. So, iske bare mein, I have one more expert joining us, which is Dr. Shradha Chaudhari. So, my next question is for Dr. Shradha. So, Dr. Shradha, Dr. Vikas mentioned that infertility in men as well as women is being seen with people who are obese. So can you shed some more light on how obesity in men and women is causing them to, struggle with fertility issues?
All right. So let me try to make it simple. Infertility is broadly divided into male factor and female factor. And female factor infertility can be linked to either the egg development, which is faulty, which is called as anovulation or ovulation not happening, or other factors like tubal factor, uterine anatomy factor, cervical factor. When we talk about obesity in women, the one and most primary important problem which happens is that the ovulation is completely disturbed, and what the woman suffers from is called anovulatory cycles. So whether or not she gets a period every month, sometimes they get a period every month and sometimes they don't get periods every month, these women who are obese and polycystic ovaries, but they don't make an egg. So if they don't make an egg and the egg doesn't develop and it doesn't rupture from the ovary, fertilization cannot happen naturally. So the primary mechanism of infertility in an obese woman is linked to ovulation disturbances or anovulation, and along with it, the woman also suffers from period disturbances. Whereas in a man, there are other factors. There can be erectile dysfunction. The scrotum is closer to the body because of the obesity and the body habitus. So this increases the scrotal temperature and it causes destruction of the sperm. So this can be a cause of low sperm count. Then the patient's serum hormone levels, the male hormone levels in the both the women and the female are completely disrupted because the metabolism of fat and the hormones which are secreted by body fat and the sex hormones, they are all interlinked when it comes to their getting active in the body and to play their right role. So in a nutshell, the body fat and the sex hormones are dysregulating each other and they don't allow the sex hormone to act properly and to form the normal egg and to rupture the egg and to have an egg which can fertilize with a viable sperm. So this is in a broad nutshell about what goes wrong in obese women and obese men and why they are infertile.
थैंक यू डॉक्टर ऑल्सो मतलब आजकल काफी देखा जाता है कि पीसीओडी करके जो एक टर्म है ये ओबीज वुमेन में बहुत कॉमनली देखा जाता है सो ये पीसीओडी क्या है एंड इज दिस आल्सो व्हाट इज कंट्रीब्यूटिंग टू एन एक्सटेंट that women find it difficult to conceive or have fertility issues, and is there a link between obesity and PCOS?
Yeah, there is definitely a very direct link that we may have more than half of our polycystic ovarian women who are obese. And vice versa, if I have an obese woman who comes into my clinic and I ask her her history, and she does have a clinical picture of polycystic ovaries. Because what happens in polycystic ovaries is multiple small eggs get developed in the egg instead of a single egg which starts growing. The normal ovulation cycle, the woman starts picking up one egg from one ovary. It starts developing, growing to a particular size. And when it has reached the right size, it bursts from the surface of the ovary. And that's when the sperm can meet it in the fallopian tube and make a baby. So in polycystic ovaries, this whole cycle is disturbed. And instead of making one egg which grows, she has multiple eggs. Along with that, as I said, that the hormones also get disrupted in obese women and polycystic ovarian women. They also have the clinical picture of unwanted body hair, acne over the face, acne over the body, hair fall. They have dark pigmentation over the neck, and these cause not only infertility issues, but we also mentioned, my previous speakers mentioned about body image and how it affects the personality and how these stressors, these are all stressors, they do not allow a woman to conceive. A woman who is trying to conceive, who has some mental stressors, she doesn't have a normal mechanism of ovulation, whether or not she's obese, whether or not she's polycystic ovaries. So they all get interlinked, and obesity, polycystic ovaries, mental stress have a very great role to play with in infertility.
थैंक यू डॉक्टर एक और चीज जो पूछनी थी आपसे इज दैट के व्हेन अ a woman is struggling to conceive या infertility का challenge होता है, so doctors guide them कि you can take in vitro fertilization as an approach. So in obese women, is IVF possible? Is it a challenge? Is it same as if somebody who is non-obese and struggling with fertility issues has to undergo IVF? इसमें क्या फर्क
No,
होता है obesity में?
it's not the same. So we reach the stage of IVF when a woman has not been able to conceive by the other artificial methods. Like, let us say I have an obese polycystic ovaries woman who's not making eggs. I first try her with tablets, then I try her with injections. I ask her to try naturally. We check the semen count, check the sperms. And if she's tried like that for a good period of time, then we go to the IVF. So the hormonal milieu in the body, even if we've made the two gametes meet outside in a petri dish, what is IVF? IVF is where the sperm and the egg in a lab is fertilized outside the body, and when this developing embryo is put inside the woman's body. Now, obese women, after the embryo is also being put in, she doesn't make good endometrium, which will receive the endometrium. There are inflammatory markers which are produced by these by the adipose tissue in the body, which do not allow the process of conception to happen. Now, even after conception has happened, obese women are known to have a much higher risk of abortions. So it's not the same as another woman who's not obese, who's reached the IVF stage. Let's say the semen was having an azoospermic or no sperms. So she went for an IVF cycle. Now this woman will have a much better result as compared to an obese woman who did not make eggs and we moved on to the stage of IVF. Her conception, her carrying forward a healthy pregnancy to the stage where the baby can be viable and have a healthy baby is definitely far more complicated.
And do you think that losing weight, so Dr. Parjeet mentioned that losing weight is beneficial to that extent that diabetes reversal can be achieved. Is something similar possible here also, that a
Very
woman who
true.
is struggling with obesity and fertility, if she manages to lose weight, will it,
Very true.
increase her fertility chances?
Yeah, it's a very common thing which we see in our clinic is a woman, the moment she comes with some amount of weight loss, she's put some effort to lose weight, whether it be her lifestyle changes or whether we have a woman who's crossed her BMI of 40 and then asking her to do lifestyle changes doesn't work. She comes back to me after a bariatric surgery. There's a whole world of difference in her menstrual pattern. She starts menstruating regularly. Her body hair starts reducing. She starts making eggs naturally. So the body weight has a very, very, very strong connection with the entire hormonal and the fertility of this woman.
Okay, thank you, doctor. So bariatric surgery is something that I picked up, and I want to ask this question to our expert, Dr. Vikas Singhal. So both Dr. Parjeet and Dr. Shraddha have mentioned that weight loss can be beneficial for patients who are struggling with diabetes or patients who are struggling with fertility, and bariatric surgery as an approach is something that helps, obese patients who are struggling with weight loss. So ये क्या होता है? Just can you explain us in a nutshell what is bariatric surgery and how actually does it benefit people who are trying to lose weight, Dr. Vikas?
So bariatric surgery is basically a GI or gastrointestinal operation. It used to be confused with cosmetic surgery such as liposuction, but to clarify that point, it is a surgery that is almost always done laparoscopically with small cuts. There are two common types of bariatric surgery. One is a sleeve gastrectomy, one is a gastric bypass. Both of them are gastrointestinal surgeries which work in different ways. More or less, all the bariatric surgeries cut down, correct the imbalance between calorie intake and calorie consumption, which primarily is the reason for obesity, because we are taking in either too many or the wrong calories, or we are not consuming them, which over a period of time leads to calorie excess, fat stores, and all the host of problems that come with obesity. Simultaneously with bariatric surgery, we see there are a lot of hormonal changes or metabolic changes that happen in the body. To give you an example, like we talk about diabetes treatment with bariatric surgery, the weight loss takes time. The weight loss is not immediate. The weight loss may take, the patient may lose 8-10 kgs in a month. But we see that the sugar profile improves immediately the day after the surgery. When the patient gets started on a diet, we find that their sugars are much better controlled. So the obvious reason for that is the hormonal or metabolic changes that come along with the bariatric surgery. Uh, that in itself is a complex topic, but more or less what happens is that with the commonly done sleeve gastrectomy procedure, we find that there is a change in body's hormones such as ghrelin and leptins. It's made in the stomach. So the appetite becomes less and the glucose absorption goes down, reduces. So we are not absorbing that much glucose from our intestines. And especially with the gastric bypass, we find that there are insulin-like hormones that get secreted. So the body's insulin that was not working well starts working better immediately the next day after the surgery. So we find that the blood sugars start improving immediately. So that is why the bariatric surgery is nowadays there is a push to call it metabolic surgery, because we know, traditionally when we say bariatric surgery, it is identified with weight reduction. So here with metabolic surgery, the goal is not just weight reduction. The goal is actually to treat all the metabolic problems such as diabetes and cholesterol, high blood pressure, the metabolic problems. So there are different indications for bariatric or metabolic surgery. In Asian patients, the indications for bariatric surgery are BMI more than 37.5 or more than 32.5, along with metabolic problems such as diabetes or other sleep apnea, heart problems, the problems that come with obesity. This has been further lowered down, that when we look at it only as a metabolic procedure, that if somebody is not able to achieve sugar control, even at a lower BMI, less than 32.5, with the best medical management, then we may consider metabolic surgery in those patients, even at a lower weight. So yes, so that in a nutshell, bariatric or metabolic surgery is a surgery, is a gastrointestinal procedure. There are different types of bariatric and metabolic procedures. Which procedure we choose is a long discussion between, with the patient. We go through all the benefits, some downsides of each procedure, and what will be befitting for that individual patient based upon their profile. So that more or less is bariatric or metabolic surgery.
Thank you, doctor. So, in your practice or in your expertise, what percentage of patients do you think who undergo bariatric surgery and are diabetics can actually expect to achieve resolution of diabetes completely? For example, if a patient was, say, morbidly obese and having very high blood sugar levels, very high HbA1c, is it possible that he can have complete resolution some 6-7 months or 1 year post bariatric surgery? How is the timeline for recovery also post bariatric surgery? If you can share some advice on that.
Yeah, the diabetes cure or remission or improvement. So those are three things which may happen in some patients actually immediately after the surgery. And some patients, it may take a few months. But what we know is that the control improves immediately in almost all the patients. There are other factors that determine the cure. So the cure means coming off all medicines for diabetes, whether insulins or oral hypoglycemic agents. The cure is seen to happen in almost 60% patients. There are studies now, even at 5 years down after bariatric surgery, where most patients, more than 50%, have been able to stay off the treatment for diabetes or achieve cure at 5 years down. Some patients over a period of time may need to go back on some oral tablets, but generally overall the control is significantly better. Control meaning if they were on insulin, we may be able to switch them over to oral agents. If they were on oral agents, we may be able to cut down the dose, cut down the medicines, and even with those medicines achieve a better sugar control, better HbA1c. So those things are there. So yes, about 60% generally is the cure rate, and a much higher control rate is there. One point to specify here is that अगर किसी को डायबिटीज की शुरुआत है और वो ओबीज है, तो उनको सर्जरी का पहले सोचना चाहिए, क्योंकि अगर डायबिटीज की शुरुआत है, शुगर्स बहुत हाई नहीं है, HbA1c बहुत हाई नहीं है, तो उस पेशेंट का उनका क्योर का चांस मोर देन 90% होता है. अगर हम वहीं पे देखें कि कोई पेशेंट जो 5 साल से ज्यादा डायबिटिक ऑलरेडी है, जिनका ऑलरेडी जो हम कहते हैं बीटा सेल रिजर्व है ऑलरेडी कम है, या शुगर्स बहुत हाई है, HbA1c बहुत हाई है, वहां पे शुगर का जनरली हम देखते हैं क्योर नहीं हो पाता, कंट्रोल इंप्रूव करता है. there are other blood tests also that we can do, C-peptide, other tests are there that we can do to help patients predict their scoring systems that we can use. There is a diarrhea score that we use that helps predict what are the chances that diabetes will be completely cured in a patient with the bariatric surgery. But yes, more or less 50 to 60% patients can expect to be completely cured and off their medicines for a good number of years that we have seen. And eventually, even if they become diabetic later on, hopefully they would have had a good number of years where the sugar would not have been, high sugars would not have been affecting their, affecting their body throughout.
Thank you, doctor. Another question is, Dr. Shradha mentioned that women who can lose weight have better chances of getting pregnant. And considering bariatric surgery as a procedure, how long do you think women should, how long would be the recovery before a woman can start planning pregnancy? And how does having a surgery, like bariatric surgery, does it affect a woman's chance of a healthy natural pregnancy? Is there any risk associated with that, or is it like normal, how others would have a normal pregnancy?
So there were a lot of questions there. I think there were like 3 questions.
Okay, I'll take one, the first one. How soon a woman post bariatric surgery can start planning, like what after the recovery process can start planning her pregnancy?
So I would be advised that wait minimum of 12 months, ideally more than 18 months for pregnancy. So for 2 reasons. One is that yes, pregnancy would interrupt the weight loss process. And if you're having bariatric surgery, then you need to have the full benefit of the surgery. The fertility improves, and if they become pregnant, then there are problems like gestational diabetes and other preeclampsia. All those would be reduced if they have already lost weight and had the benefit of bariatric surgery. So yes, ideally wait minimum of 12 months, preferably more than 18 months to conceive after the bariatric surgery.
And the second part of the question was, would these women who have undergone bariatric surgery, can they have a normal healthy pregnancy as compared to women who do not have undergone bariatric surgery?
Yes, absolutely they can. They should, but they should inform their obstetrician that they have undergone bariatric surgery, because they would need to be carefully screened, especially if they've had a malabsorptive procedure. They should have the complete nutritional profile, including folic acid and iron, number of blood tests that are generally done anyway during the obstetric screen. But so they may need more supplements, higher doses of supplements than other patients who've not undergone the surgery. But yes, definitely they should mention it, and they should ideally discuss it with their bariatric surgeon as well, apart from their obstetrician. But yes, with monitoring, they should actually fare better than expected.
Thank you so much, doctor. That brings us to the end of this session. We've learned a lot. I'm sure the audience has also learned a lot about obesity, the complications associated with it, and how weight loss, particularly if there's morbid obesity, severe obesity, weight loss through bariatric surgery can help with conditions like diabetes and infertility. Just as a conclusion, before we sign off, I would like to ask you, Dr. Vikas Singhal, if you had to give a message to our audience who is watching and who are probably struggling with these day-to-day things coming with obesity, what would be your message to help them overcome obesity and live a healthier life?
So my message would be that yes, obesity tends to be a lifelong problem and a struggle, but you need to be carefully evaluated, seek help timely. Sometimes there are a number of identifiable causes where obesity can be treated. So don't just try to treat it yourself with just diet correction. There are a number of complex issues there that we can address with our specialized teams at the hospital, who would screen you out for if there are any causes of obesity. And then there are a number of treatment options. The good news is that there is a range of treatment options, starting going up the ladder from diet, exercise, medications, endoscopic, bariatric surgery. Seek help early, before especially with COVID times. We have seen that these are chronic illnesses that should be addressed and treated timely. So but yes, a lot of help is available, and make sure you get it timely.
Thank you, doctor. That was a wonderful message. Same question I would like to ask Dr. Parjeet as well. So, doctor, you mentioned wonderfully about weight loss and diabetes reversal. So, I'm sure a lot of audience here is, relating to that. What message would you like to give audience who are fighting obesity, diabetes particularly, and how to go about managing it?
Right, so my message should be that one should be aware of the ill effects of obesity, especially the type 2 diabetes, because type 2 diabetes is a chronic disease and one can prevent type 2 diabetes by keeping a check of the body weight. And prevention of obesity actually should start right from the childhood, because we are seeing large number of increasing obesity cases even in children. So following a good, healthy, balanced diet and a regular physical activity can go a long way in prevention of obesity and type 2 diabetes. One should be aware of the regular checkups, and one should actually contact their doctors regularly if their body weight is more, for checkups to find out about their sugar levels, cholesterol levels, check their blood pressure. And as Dr. Vikas said, we have now multiple options available. One should be aware of the treatment options, including medical treatment as well as surgical options. So yes, the help is there. The note is positive here. We can prevent it, and once if you have diabetes and overweight or obese, yes, we can tackle with it. Yeah.
Thank you so much, Dr. Parjeet. That was quite a brilliant advice. Same question to Dr. Shraddha. So you also covered how obese women can, aim to become pregnant, aim to achieve a normal motherhood. So wanted to take your take, your message on this. What would be your message to the audience that's watching us today, and they are obese and wanting to have a healthy pregnancy, a healthy baby? How would you tell them to go about managing this?
So my message to everybody who is either going towards obese, or who is not obese but looks at obese, or somebody who's already obese, whether it's morbidly or overweight, is every day is equally important in your life. The way you lead your life, whether it comes to diet, whether it comes to exercise, and your stressors, they play a very great role in what's going to happen to you in your future. So please take each day and each step very carefully when it comes to your food, your exercise, and your mental stress levels. When you go to the stage where your weight is going out of your control, whether it is overweight or whether it is obesity or morbidly obese, don't lose hope. I think that's my biggest message to everybody. Please don't lose hope. Don't come into the doctor's room with a face that you're completely depressed. It's very sad to see adolescent young girls who suffer from major depression because of obesity. So please don't lose hope. Doctors are here. We have multiple options for you in the form of medications, in the form of counseling, in the form of therapy. And slowly and steadily, we can always win this race for you. This is my message to all my women.
Thank you so much, Doctor. Again, a wonderful message. Wonderful messages coming from all three of you. I'm sure the audience who joined us today has gained a lot in terms of not only living, fighting, but also staying positive with obesity and conditions like diabetes or infertility or other associated conditions. And I'm sure they will be motivated to take their health in control by listening to expert advice coming from all you stalwarts. So, thank you, one and all, for joining us today. Thank you, doctors, for sharing your valuable insights. Thanks and have a good evening.
Thank you.
Thank you. Thank you for having us here.